Good morning, everyone. Thanks for being here. I'm Katie Earle. I coordinate our University Express program, and I work for the Erie County Department of Senior Services. And we're back for a third and final time with Darcie Hanson from Highmark BlueCross BlueShield, and we're doing high blood pressure the entire time today. So thank you all for being
Right.
here. We are recording the session, and if all goes as planned, I'll post it in the near future. Same thing as always, put your questions right in that chat or Q&A. We've got both of them activated today, so we hope you get all your questions answered. And if you have any tips to share with everybody, share those too. Our star of the show, Darcie has been a Highmark Blue Cross Blue Shield for over 5 years in her role as a registered nurse. In addition to this, she is a per diem nurse on a medical surgical floor at Bertrand Chaffee Hospital. Darcie also has a back in social work and education. She's been teaching classes for University Express since 2019 and enjoys being able to present on different health topics that affect many people in our community, like this one. Darcie, thank you. It's all yours.
Great. Thanks for being here. Thanks for joining, everyone. So today we're going to talk about high blood pressure and a little bit about the numbers and ways to prevent high blood pressure and work on that. So let's go ahead and get started. So the first slide is just what is high blood pressure. So just the basic definition is high blood pressure occurs when the force of the blood flowing through the blood vessels is consistently too high. So that's over a period of time. So if you have one high blood pressure reading, you're not likely going to be diagnosed with high blood pressure. But if it seems to be something that's continuing over time through checkups, or if you're monitoring on your own, that's when you may get more into that diagnosis of high blood pressure. So I added this slide for recently about taking your blood pressure. So sometimes people will ask what's the best position or what time and things like that. So best position to take blood pressure is seated in a chair. Feet should be flat and arm resting on a table next to you at heart level. No smoke, don't smoke, drink, eat anything with caffeine, or drink anything with caffeine or exercise within 30 minutes of taking your blood pressure. That tends to affect your blood pressure. So you're not going to want to get up, work out, and then take your blood pressure because it's obviously going to be a little elevated. So get up in the morning, go to the bathroom, sit down, take your blood pressure would probably be a good time. Measure same time every day. Just to be consistent and see where you're at, it's important to do that. So again, maybe in the morning, some people will like to do it in the evening, maybe before bed or, later on in the night. So again, seated in a chair, no smoking, drinking, or eating anything with caffeine 30 minutes prior to, and about the same time every day would be the best, would give you the most accurate readings. Another thing I want to note, and I don't have it on here, is if people are monitoring their blood pressure at home, it's important to have a cuff that is the right size for you. If you have one that's too small, you're going to have your pressure could be higher. Too loose, it's going to be a lower number than what it really is. So it's important to have an accurate one. And I know a lot of stores have them. You'll see them at the pharmacies, and that's okay to utilize as well. But just keep in mind that those aren't always the most accurate. So the best one is to have a manual cuff of your own at home to check. Okay. I know this presentation's on high blood pressure, but I also wanted to note that people have asked it during the presentations about low blood pressure. There's more symptoms of low blood pressure than high, I would think. So sometimes people's pressure is a little too low. They may feel dizzy, lightheaded, nauseous, faint, dehydrated, fatigued. They may have blurred vision. If you take your pressure and it's lower than 90/60, that's too low right there. That's falling into the low blood pressure range. Some people have low blood pressure normally. They may run in the 100s, over 60s, and that might be their baseline, and that's something that their doctor's aware of. But if you take a pressure and it's in the 80s, over 50s, that's too low. So there are different things that you can do. Some people have medications that help increase it, but you want to drink some water. You want to sit or lie down when symptoms are low. You don't want to be moving around and doing things because you don't want to possibly faint. So just a little blurb on low blood pressure to keep in mind. If you are checking it and those numbers fall lower than 90/60, it's definitely something to be aware of and to make sure your doctor knows as well. That happens a lot too when people are dehydrated. So it's important to also stay hydrated because your numbers, will be affected by that. Okay, so this next slide, and I know there's some people that are just calling in. I have on this next slide, so I'll kind of read through it a little bit. Just the ranges for blood pressures, and where the normal range is less than 120 over less than 80. You get into a category of pre-hypertension when it's 120s to 129, still less than 80 on the bottom. Then there's different stages: high blood pressure stage 1, 2, and hypertensive crisis. So with stage 1, you're in the 130s over 80s to 89s. High blood pressure stage 2, you're hitting the 140s to 90s. And then hypertensive crisis is when your pressure is higher than 180 on the top number, the systolic, and higher than 110 on the bottom. It's kind of a lot to listen to, but if you are able, I think we send out the PowerPoint sometimes, you'll have those ranges. So what do the numbers actually mean? So normal ranges obviously are within a normal range. You're doing fine, pressures look good. When you hit that hypertension stage, it's early stages. So a lot of people at this time, this is the time to kind of make changes before it turns into high blood pressure. So they may notice when they go to the doctors that their pressure is a little bit higher here and there. They'll start thinking about things to do to help lower it. We're talking lifestyle changes, diet, and exercise are the big ones that are going to help with that blood pressure. Same thing with high hypertension stage 1. So if you're consistently in that 130s range, again, you're going to do those lifestyle changes, and this is a point where your doctor may possibly prescribe a medication to help lower your blood pressure. Some people don't want to take any more medication, and that's okay too, but you're definitely going to have to do some of those changes if you want to get that pressure lower. And we'll talk more about that stuff too. Hypertension stage 2, again, you're doing a combination of medications and lifestyles at this range. And when you hit that and hopefully you don't hit that hypertensive crisis, this is when you're going to actually need medical emergency, attention. So you have a hypertension urgency or emergency, and those are the type of things that you need to go to the hospital for, because it's at this point, it's too late in that moment, and you're going to have to seek medical attention. Hopefully you never get to that phase, that range, but sometimes that just happens with people, and you definitely want to seek medical attention then. So the next slide, we just talk a little bit about risk factors of high blood pressure, and a big one is our lifestyle, our physical activity, and diet. If you're eating a diet with a lot of sodium, fats, not really watching what you're eating at all, that's definitely going to lead to high blood pressure issues. Physical activity, if you're somebody that doesn't really do a lot of physical activity, that's a risk factor as well. Age, as we get older, our blood pressure changes and it tends to be higher. So obviously that's something that you cannot really control, like the lifestyle changes. Family history is another one. That's something that cannot be controlled. Some people have there's a family history of it, so they kind of are aware of that and already sort of doing things to prevent it. Gender, males tend to have higher blood pressure. African Americans, and smoking and stress will definitely increase your chances of high blood pressure. So if you're looking at this list, obviously there's a few on there that just happens. So you really want to try to focus on those ones that you can change, like your lifestyle, smoking, stress. So there's not a lot of symptoms of high blood pressure, and often people refer to it as the quote silent killer, which is kind of a harsh name, but it's just due to the fact that a lot of people have no idea. There's no problems. You're going about your business. Some people never really go to the doctor, so they never really have it monitored. So they have no idea until unfortunately something happens, and then they're, diagnosed with that as well. So having high blood pressure, what health issues can occur with high blood pressure? I just put some of the more popular ones on this slideshow. So a stroke is one that can definitely occur when your blood is pumping at that higher higher force all the time, you could definitely lead to a stroke. Heart failure is another one. So that's a progressive heart disease that affects how the heart muscles are pumping. So eventually they stop pumping as well as they normally would. Heart attack, which is damage to the heart muscles caused by loss of blood supply. That's often due to blocked arteries. There can be vision loss, sexual dysfunction, kidney disease and failure, peripheral artery disease. I mean, obviously, blood is pumping through our entire body all the time. So if it's being forced through a faster rate and harder rate, it's definitely going to affect some of those arteries throughout our body. So just treatments for blood pressure, high blood pressure, lifestyle changes, reducing stress, no smoking, and limiting alcohol. We'll talk a little bit more about the nutrition part coming up. So you really want to look at your sodium intake. That's a big one. Sodium, when you eat a high sodium diet, you're retaining sodium retains water, which is going to lead to an increase in your blood pressure. So you definitely want to take a look at that. Weight management. Medications will help, regular physical activity, and monitoring your blood pressure. We'll go into some of these a little bit deeper. Okay, so I mentioned the nutrition part, which is decreasing the sodium. So I focus a lot on that, and I have some extra handouts for us that kind of will show you some foods to kind of avoid, and it's a little bit more detail on some of those high sodium foods. So like I had mentioned, sodium helps retain fluid. Extra fluid equals extra strain on the heart. I've listed some foods high in potassium because that helps to lessen the effects of sodium and decrease the tension on the blood vessel walls. So some of the things I listed were apricots, bananas, cantaloupe, oranges, grapefruits. You want to choose fruits and veggies, whole grains, low-fat dairy, lean chicken, and fish. Okay, so on average, Americans should consume around 2,300 milligrams of salt a day. So if you're trying to watch your sodium, you're going to want to start looking at labels because that's the only way to really kind of determine how much sodium is in the foods that you're buying at the store. If you want to eat a low sodium diet, you would want to decrease it to about 1,500 milligrams a day. So that's the number you would sort of want to stay at if you're looking to decrease your sodium. You need some sodium in your diet because it helps with fluid regulation in your body. So you just don't, and there's sodium in everything you eat. So you're not going to be able to cut it out totally, but to go around that 1,500 is a good place to lie if you do want to do a low sodium diet. I always say, like this last one, on average, most people consume 8,000 to 9,000 milligrams a day, which is that what, 4 times of what you should be eating. And it seems so crazy to think that you can do that. But if you really think about it, if you're eating out for breakfast, you know, let's just say Tim Hortons, you get a breakfast sandwich, you get hash browns. For lunch, you go out, you have a cheeseburger and French fries. Maybe dinner, you have, I don't even know, something that's not good for you as well. So it can really, really add up. So you just have to be really aware of what you're eating. And sometimes it's hard when you're eating on the go and things like that, but it's really important to watch that sodium. So 1 teaspoon of table salt is equal to 2,000 milligrams. So we all know how small 1 teaspoon of salt is. So if you are somebody that likes to make your own like soups and things like that, you can obviously monitor better how you're seasoning it rather than buying it at the store. But just be aware, like a lot of people I talk to, the biggest thing they do is table salt. So one of the big things we try to work on is just decreasing adding any extra salt to your foods. That's even a good step in the right direction. If you're someone that, you know, eats a lot of salt or always has to salt their foods, just taking that away, because when you're seasoning your food, you're not really measuring it. You're just seasoning your plate if that's something that you like to do. So just keeping in mind that that's such a small amount, but it's equal to almost what you should be having a day. I always find that interesting. I just like to put that in there. Okay. again, well, I have a different slide or a different handout with the foods high in sodium, but these are some things that are really high in sodium. So you're talking the canned soups and veggies. I know that they have a lot more choices nowadays with the soups with low sodium. So if you are somebody that likes those canned soups, just trying to do that low sodium option would be helpful. Vegetables, if you do have a canned veggie, trying to rinse off it would be better. Yep, someone just put a note in there about breads? Yes, that's another thing too. And thank you for pointing that out. That's on my other sheet too. One of the things is bread. So yes, they do as well. Deli meats, ham and salami, that's just, everybody probably already is aware of these kind of foods. Bacon, sausage, hot dogs, ham, we always have ham for Easter. You always feel like real thirsty after, if you've ever noticed that. Like you can tell, like that's one of those foods that really high in sodium. Frozen dinners are kind of tricky because, well, not all of them, but like the lean cuisines and things like that. Because I used to be on a kick of those a long time ago. So if you do eat one of those, maybe they do have a lot of sodium. Look for ones that have a little less, but maybe just like one a day would be sufficient. Some people, they have like breakfast, lunch, dinner ones too, but kind of limiting that. Spaghetti sauces is probably more with like um uh the tomatoes and the different ingredients put into it, cheese and condiments. So a lot with the condiments, you're talking barbecues, soy sauces, those have a lot, some salad dressing. So it just depends on what you like to eat. So you really want to start looking at labels if you want to watch that sodium. But the biggest ones are definitely the frozen dinners. And I know some people, they eat a lot of those lasagnas and things like that, but there's a lot of salt in those. So just being aware of that. I'm sorry. So I had mentioned too, if it gets to the point where you need to make those changes and maybe diet lifestyle's not working enough, your doctor may prescribe medications. I don't have all of them listed here because there's so many medications that you can take. And it's always important because I don't know what everybody takes. So these are conversations to have with your doctor and they would know what reacts with certain things. But you always want to take your medication as ordered. A lot of times they're prescribed diuretics, which help to get rid of sodium in water. And then I have listed here several types of blood pressure medications like beta blockers and ACE inhibitors. Some resources that I thought were helpful before I get my other slides up. American Heart Association has educational resources. They have trackers on there, which are basically just sheets that you can track your blood pressure on, high risk calculators to see if you are at risk, and a lot of support on there. I really like the American Heart Association for like the nutritional part too, because I feel like they have a ton of different options on there and recipes. So if you're somebody that wants to get, serious about looking at their foods and what they eat, and you have access to the internet, take a peek on there because sometimes people get, I don't want to know if I want to use the word bored, but sometimes after a while they're eating the same thing. This is pretty cool because they have lunch, breakfast, lunch, dinner meals. They have like little appetizers, soups, all different things on there if you want to try to switch it up a little bit to keep you in the right direction, but a little bit different so you're not having the same thing every day for dinner or lunch or whatnot. Does anybody have any questions about the PowerPoint right now before I pull up the other sheets, which is a food sheet and just some other things about high blood pressure?
We have a couple questions about levels, if I can go ahead and read those to you, Darcie.
Yeah.
So this first one is, what is an appropriate frequency for someone who has elevated blood pressure? I think we touched on it, but their example, 130s to 150s over mid 70s.
I'm going to go back. So I talk to some people sometimes where they're like, I'm always in the 130s. That's my baseline, whatnot. These numbers are guidelines. So if your doctor knows where you lie, has you maybe prescribed something or understands where your blood pressure range is, then that's what's good for you. If you're somebody that doesn't have any history of anything and all of a sudden you're always in the 140s over, let's say 140s over 95, then that's a cause for concern, because that it's like, well, what's going on with you? But if your baseline is sort of around there and your doctor's comfortable with that and wants you to stay around there, then that's what works good for you. So you definitely want to have that conversation with your doctor about your body and where they want you to be at. So I hope that is that an answer enough for you? Like, I'm not sure if I answered that correctly for you.
Well, if not, then
Yeah,
the
if
person
not, write
can,
it or let us know,
yeah,
but
that's okay.
mhm.
So yeah, if you want more clarification, you can go ahead and put it in the chat again,
Yeah.
and we'll keep kind of breaking it down. This one is, what does it mean if the systolic pressure is stage 2, but the diastolic is consistently in the 70s or low 80s?
So the systolic and diastolic are like two different things. So one is when your blood is pumping, which is the systolic, and diastolic is when it's contracting. So um I that I'm just trying to think how to answer that. I don't, it could just be that it's a little higher for one than the other. Um, when your heart is doing one thing but not the other, it's working a little bit harder to pump the blood than it is to contract the blood. So sometimes I see that too in the hospital, and your doctor may prescribe something that will work, that would work for one part of it more than the other, if that makes sense. It doesn't necessarily mean anything bad. It just means that, like I said, your body, when it contracts, it could be, working harder than it normally should and whatnot. So that's another thing to look at with your doctor too. If that's how it is consistently, I would say they may want to, the one that's higher, they may want to gear towards that one to see what they can do to help lower that number.
Okay, that makes sense. Thank you. This next one is high blood pressure an indicator of blocked arteries then?
It could be if your blood pressure is starting to be consistently high, it could be an indication that there's something going on with your arteries, that you could have some blockages. And you may want to start doing those lifestyle changes. It's not, doesn't mean it definitely is, but it could be an indication that things aren't flowing like they should be because of some blockages.
Okay, thank you. And then this last thing I'm seeing is, it used to be 100 plus your age years ago.
Oh my gosh, I have that much. I don't know. That's interesting. So your systolic used to be 100 plus however old you are. That's actually interesting. I have not heard that,
Mm.
but I think it's probably changed now then, because obviously, oh, somebody else just wrote there. Remember that.
And I
Obviously
remember,
that's changed a little bit, right?
and I
Especially for
remember,
some people. What's that?
I was going to say, I remember my grandmother worked in a doctor's office for years and years, and she used to always say that.
Yeah,
So it's kind of funny.
it is, because now it's like, even for me, I would be in the 140s all the time, and that's not someplace that I should be at. So that's actually funny. Yes, I think it's changed a little since.
Yep. I'm not seeing anything else, Darcy. So if you want to go to your
Let
handouts,
me
let me
see.
know if you need my help.
Well, I likely will, because I always mess this up. So let me just wait, stop sharing. I don't know why I cannot figure this out. You would think this is not too hard. So if I go on the bottom, is this my whole screen then?
So you've got share, and then since you have those handouts, Adobe should be an option in your share box that you can click on.
Will this bring all of them up, Juno?
Yep. Yep. You can click
Oh,
through the three on the top. We see them.
oh yeah, okay. So this is just kind of a summary of what we already talked about, but I like these handouts because it's all in one sheet and it breaks it down for you. So how can I reduce blood pressure? Sort of the same thing we mentioned. Reaching and maintaining a healthy weight, you want to eat that heart healthy diet, which is the rich in fruits and veggies, whole grains, chicken, fish, vegetable oils, nuts, and things like that. You want to really limit it. I obviously stressed on the sodium, sweets, sugar, sweetened beverages, and red meats, and choose some foods rich in potassium. Increasing your physical activity, avoiding that smoke and secondhand smoke. And it talks a little bit about limiting alcohol, how many drinks, to no more than one drink per day for a woman and 2 drinks a day for men. If you are on a medication, taking it the way the doctor tells you. And like we mentioned with the one question about the 130s, like knowing what your blood pressure should be and working at it to keep it that level. What's good for you may not be good for me, and vice versa for everybody on this call. So if your doctor's comfortable with you at, let's say, I don't know, 125 to 135, and they want you at that systolic range, then that's where you want to work to keep it. And then this talks about like losing weight and how do you limit sodium and limiting alcohol and being more active and what you should know about your medication. Never stop, never stop treatment on your own. I know so many people, including somebody that I love very much who has done this, and you would think he would not do this because I'm a nurse and I am drilling in his head, but you don't just stop taking your medication because you feel good or I took your blood pressure one time and it was good. You're on a treatment for a reason. Maybe over time, your doctor may say, if you, let's say you start on a medication and over a period of time, you lose some weight, you're active every day, and your blood pressure is at a good range, your doctor may taper that off or may say, okay, you can stop this or see if anything, if you have any issues, continue, we'll go back to it. Just never stop it on your own, please, because you don't want to do that. And that's when issues start. If you're on it for a reason, just stick out the course of treatment, have that conversation with your doctor, and go from there. This is another sheet with the numbers, which I think Katie can send out to you guys too. And again, it's basically what we talked about, but in a more condensed version, so you don't have to carry it. You might want to print this up instead of a whole PowerPoint. Just talks about what blood pressure is, like we mentioned, the force of blood pushing against the blood vessel walls, and it gives you the numbers, that ranges that we talked about. The risk factors, again, smoking, diabetes, being obese or overweight, high cholesterol, unhealthy diet, and physical inactivity. So definitely things that we can all change here and work on, everybody, and I always say this too, like the diet that we should be eating is what everybody should be eating regardless. Like it's always good to eat fruits and vegetables and whole grains and lean meats. It's not, so never, I feel like sometimes people are like, oh, I don't want to have to change my diet or restrict. It's like how everybody should eat, but we just have to all work on it. It's a work in progress. Let's see, we talked about the risk factors. And the only way to know if you have high blood pressure is to get it checked regularly by your healthcare provider. Again, you can always check it too with your cough, or maybe you have a relative that's a nurse or a doctor, they can check it for you, but you're not going to know otherwise unless you're checking it or seeing those numbers. Okay. I always hand this one out, the Salty 6. This is my last handout. So these are 6 popular foods that can add a lot of sodium to your diet. And one of the comments were about the bread and rolls. And there's something that they put in with the yeast to help the bread and rolls rise or do whatever they do to be yummy, but that's definitely high in sodium. Pizza. So if you think about a slice of pizza, so you have the dough, obviously, you have the sauce, but now we're putting cheese, and a lot of people like toppings like pepperoni and sausage and things like that. So that's definitely going to add to your sodium level. So if you are having a slice of, obviously I'm not telling anybody to cut out pizza from their lives because I cannot do that myself. But if you are, think about, in moderation, one slice and maybe have a salad with it. Or sometimes I like to, which I'll do like a cauliflower crust, which if I even mention cauliflower crust in my house, my kids will like run the other way, but it just tastes good and nobody believes me. They don't want to try it, but trying something different like that, a cauliflower crusted pizza, you could buy them at the store, see if you like it. But if you don't want to go that route, maybe having just like cheese and maybe a couple different veggies on your pizza, but still enjoying it, but tweaking it a little bit. Sandwiches, and I think it's more related to like cheese and the lunch meat that you put in the sandwich. So trying to do those like leaner chicken or turkey options are a little bit better than the ham, salami, bologna. And again, if you're going to have a ham sandwich, in moderation, keeping in mind of what else you're eating throughout the day to kind of keep you at that number you want to stay at. We just mentioned the cold cuts and cured meats. I talked about the soups. And here it's saying one can of soup can range from 100 to as much as 940 milligrams, which is more than half of your daily recommended intake. So if you are going to have a can of soup, try to do the low sodium, or again, just realize how much you're actually taking in from that soup and still trying to keep into that range. So burritos and tacos are just a lot with the fillings, with the meats and the cheeses and stuff like that. So if you want a taco, try to do some more veggies, a little less meat, or tweaking it to a way where you can still enjoy having one. But and they do have cauliflower taco shells because I have bought them and I think they are fine. Of course, they're not as good as the white ones, but again, sometimes just trying something new like that and tweaking it, you may be pleasantly surprised. So I can definitely make sure Katie gets these too if you guys think that would be helpful for you. Do you have any other questions, comments? Does anybody I always like to, if you have something to share, maybe you found something was helpful or you thought there was an alternative to something I mentioned that you enjoy eating or something like that, you can please feel free to share it with the class because that's always nice to hear.
Thanks, Darcie. We have someone that put in here, my blood pressure is low normal for the first time in 10 years with a plant-based diet.
Oh, wow. Yeah, I can imagine the plant-based would be good. That's excellent. Good for you. So I'm imagining in the beginning it was scary to I feel like whenever you try to start something new, it seems so foreign to you. But now after 10 years, that's great. It's probably secondhand and you found things that you enjoy. That's great. Definitely something to keep in mind if people want to try something.
We have someone that's wondering, where do you find the cauliflower taco shells?
So I actually found them at Tops. Although I think they were over, sometimes they have the shells over near the cheese and the butter kind of section. That's where I found them. They're a little bit more expensive. If I can find them somewhere else, like Aldi's or something, I would, but I found them at Tops. Yes, you refrigerate them they were in that cooler section, like near the yogurts and stuff like that. So I liked them. No one tried them in my house, but that's okay. I'll keep trying.
Wear them down.
Yeah, I'm gonna.
I'm not seeing anything else come through, so we'll just give it a second. But if you want these slides and you're calling in, give me a call at 858-7605, and I can put them in the mail to you. And if you're on here, then I've got your email addresses. So once I get these from Darcie, I'll email everything out so you all have it.
That sounds good. Yeah.
Cool. Well, I'm just seeing, thank you so much for sharing this.
Thanks
Thank
for
you very much for
joining.
your time. So yeah, Darcie, thank you.
Thank you.
Oh,
Oh,
got some things coming through here. Are you
so
seeing
does
both of those?
drinking water. Yeah, when you're drinking a lot of water, you're definitely going to be using the bathroom and getting that added sodium out. So that's why I mentioned too, sometimes if you are somebody that retains a lot of fluid, you put that your doctor may prescribe a diuretic. That's going to help. Again, you don't, you want to have some sodium in your system for fluid excuse me. Oh my gosh. I lost my train of thought. You definitely want to have some sodium for, fluid flow and things throughout your body to help things working. But yes, you're going to drink more water. You're going to flush out more of that sodium. I thought I saw something about a wrist cuff. Was that something?
Yep. Is there any difference between wrist cuffs and arm cuffs?
Um, I think it's just obviously a different part of the body that you're checking blood pressure. There's been times in the hospital where I can't get a good reading on the arm cuff, so I'll put it a little bit lower down and I'm able to get a reading. As long as it fits right and is giving you those accurate readings, then I wouldn't see anything wrong because I've definitely had to do those kind of maneuvers in the hospital and tweak it a little bit. So as long as you're able to get a good accurate reading, I would think it's fine.
Okay. And a couple things here in the Q&A. This is what happens if you miss a dose and take it later, the next dose as scheduled?
So I actually had a little note on that too, because we were asked that. So that's what they were, that's from what I had read was recommendations to do. Don't double up or anything like that. Just take your dose the next day as directed.
Cool. Thanks, Darcie.
Hmm.
And then this last one, why don't restaurants offer more heart-healthy meals for people on the go?
I know that's a good question. It gets a little bit, I know you have to be creative when you go out to eat. Even if you go out and get a salad, you're probably and you want a low sodium salad, you're going to be cutting out different things too. I don't know. I don't know why they don't. I think that definitely would be, now that I think a lot more people are more conscientious about like how they're eating these days too. So you would think that there would be more to go options, but I guess just trying to tweak it a little bit and picking the ones that aren't as bad, but just doing the best you can. It would be good. Like those to go restaurants, like the drive-throughs, you mean? There's not a lot. Maybe try to go for a grilled chicken. I don't know. You know, it's tempting not to do that, but you have to kind of steer that way.
It is. This next thing I'm seeing is it always blows my mind that they will take the reading at the doctor's office with clothes on the arm.
Yeah. And sometimes I'll tell them too, even for I'll take my sweater off or whatever, but I know how I am. And I don't know why this happens to me. It's that white coat syndrome. You probably have all heard of it. As soon as they're like, oh, take your blood pressure, I can already feel my heart like pounding. And I don't know why, because I don't even have high blood pressure. They'll take it, it's a little elevated, and I'll always tell them, you have to take it again later on after this appointment, and it's always better. So yeah, I mean, when I take people's when I'm in the hospital working, even if they have a gown on, I'll try to lift it up just so I can hear it the best, right on the skin. So yeah, I don't know, over a sweater or something, I usually will take mine off to get the most accurate.
That makes sense.
Mhm.
Okay, well, we'll just give it another second here to see if anything else comes through, but thank you all for being so chatty. This has been really nice.
Yes, thank you, everybody.
Darcie, is there anything else you want us to know before we close?
No, I think that's it. And again, like all in moderation. I know the holidays are coming up. I mean, I already am thinking about like what's going to happen on Christmas Eve and Christmas. So don't be too down on yourself. If you have an off day, there's always the next day to get right back on track and keep moving forward. And so don't put yourself down too much. Just enjoy the holidays with your families and get back on track the next day.
All right, that's good advice. Thank you, Darcie.
Mm-hmm. You're
And everyone
welcome.
who's on, thank you so much. I'll be in touch with you all. Enjoy the rest of your day.
Bye, everyone.